Welcome to Healthy Chats with the Doc. And today we're so excited to have one of my favorite Bastyr graduates, Dr. Nataya Gwen, joining us to talk about microneedling and exosomes. So welcome, Doc.
Thank you so much, Deb. And thank you for reminding me. Wow, Bastyr feels like a million years ago, but
Yeah, I know. It's so great. I just always remember that inaugural class at Bastyr San Diego. It was wonderful.
yes, thank you. I love being an ND and I love skin health. So very excited to be here today.
It's so fantastic. So talk to us, explain to us what microneedling is, because sometimes I've heard people call it the vampire facial, and it sounds kind of scary when you talk about it like that.
Oh, definitely. Well, first of all, the vampire part is when you add the PRP to it. So microneedling itself is just using a microneedling pen and a sterile cartridge and using that on the skin to allow for micro needling, micro injuries, which are really like little pinpricks. And it's usually with 12 needles. That's what I use. And that used across the skin is very healing on its own. When we kind of wake up our skin with those little micro injuries, it causes blood flow and allows the skin to go, oh, immune system, wake up, what's going on here? We're affecting the top layers of our skin, and that alone brings healing factors, collagen building and whatnot to the skin. So microneedling on its own is a nice treatment. But whenever I hear anybody's getting microneedling and they're not adding a wonderful serum on top of that to then be absorbed into their skin for additional healing, I always feel like they're missing an important piece. So yes, PRP can be used, and that is your plasma from your own blood, and that creates the vampire effect. But you can also use exosomes, which we'll be talking about today, and that's my preferred serum to use for healing.
Okay, all right, so let's slow down a little bit. Okay, so the things women do to stay beautiful, again, I guess men too. So what you're saying is micro needling is really creating little injuries to your face. Is that what it's doing?
Yes, little pinpricks, and they're microscopic, so you can't see them. Again, this little teeny cartridge has 12 needles in it, and that's what we use with the pen, and it's vibrating, and they're moving in and out, and that's why you move along the skin. You do so quickly, and most providers do about 3 passes. And if there's additional scarring or deeper wrinkles and fine lines, then we do a little bit more in that area. But it's creating those little micro injuries that actually brings the healing to the skin.
Wow, that's crazy. So in order to make our skin shiny and glowy and beautiful, we have to make little punctures in it, and it so basically what it does is it ignites the immune system, and the little Pac-Man say, hey, injury, let's go get it fixed.
Exactly.
And that's what happened.
Yep.
Okay, cool. All right, so that makes sense. Like when you cut your finger, right, everything rushes over there to heal it, that kind of a thing. So what you're saying is, now that you've punctured your face and you've gone through the pain of it all,
Microscopic.
yeah, don't just let it heal on its own, that you can actually, there are things that you can do now to help that healing process with, what did you call them, serums, different types of serums?
Yeah, so a topical serum. And again, the first one I used was platelet-rich plasma. I did that for many years, and I've seen incredible results. But what I learned about most recently, and which has kind of taken over in my practice because my patients love it so much and they see such increased healing, is now we use exosomes.
What is an exosome?
So exosomes are extracellular. They're created when a cell and a membrane come together. We can get into the science of that if people want to know, but they're from mesenchymal cells. And what they contain in them is cytokines and growth factors, proteins for healing, and also messenger RNA that allows for the proteins to be made. There's no genetic material. And these little exosomes, part of what I love about them is they're little, they're nanoparticles. So in comparison to platelet-rich plasma, which also has growth factors in it, exosomes are smaller, so they get to the surface of our skin easier, they can absorb more easily, and they have so many more growth factors than our own plasma does that the healing is nearly exponential. It's listed as 100 times more powerful. So that's
Wow. So I get the growth factors. That makes sense to me. So now that I'm 65, yeah, my blood is 65 too, or hopefully my biological age is different than my chronological age, and I'm a little healthier than that, I hope. But
it is. I've seen you water skiing.
yeah, that's right. So I mean, am I right in, because I'm not clinical, so it's basically, if exosomes are made from placenta, and so obviously they're the richest growth factors there are. I'm 65, my blood has 65-year-old growth factors in them. Is that the right kind of thinking, in that that's why the exosomes are so much richer in growth factors?
Exactly. And that's a really great point, is with platelet-rich plasma, that is being spun down and taken from our own blood. And when we get older, we have less and less growth factors in our blood. Some of us have more and more inflammation in our blood. With exosomes, because they're coming from placenta and placental cord, there has not been that time for any damage to happen. And so you just get the most consistent and high level of growth factors for healing and tissue repair that you possibly can. And so whether I'm seeing a patient who's 60 something or 70 something, or I'm seeing a patient who's 20 but maybe has a lot of acne and they have high homocysteine, high inflammatory levels in their blood, both sets of people are going to benefit more from exosomes than they would from platelet-rich plasma. It's really only those younger, super healthy, no inflammation in the blood, tons of growth factors still in their blood, that really can benefit from platelet-rich plasma. And yet most of us fall in those other categories. We're doing microneedling with something topical to support us because we have scarring or fine lines or rosacea or solar spots, actinic keratosis, and we need those worked on. Well, exosomes are going to work a lot better for us than our own plasma.
Wow, so it's kind of like a 1-2 punch, right? So we do the microneedling to hurt and damage our skin, and then we throw on the exosomes to heal it with all these great growth factors. And so not only does in the healing, so let's talk about, so these growth factors now accelerate the healing, but do they do things like help produce more collagen, or what do these growth factors actually do?
Yes, so growth factors are signaling to the fibroblasts that are in the topical layers of our skin. They're telling the fibroblasts to then create more collagen. And so we end up making more collagen in the skin. And as we mentioned, the microneedling itself also on its own broke up old collagen that was already existing. So we're breaking up old collagen so that it can heal in a better pattern. And we're adding more collagen by the fibroblasts and being brought to the surface of the skin.
Yeah, so the I mean, the healing, obviously it's a complex process. I know a lot of times, and Dr. Schechter being a wound healing doctor, and I know he's involved with Exovex, which is one of the best exosome companies in the market out there, because wound healing actually relates a lot to skin healing, right? Because a lot of times skin is our largest organ and it covers everything. So wound healing, skin health, they go hand in hand, correct? So that's part of what you're talking about when you talk about microneedling. So is microneedling safe? Because, it sounds like, we're puncturing and, what, like, it sounds a little scary.
Yeah, the way you describe it, it does sound a little dangerous. No, microneedling in and of itself is very safe. Again, you use a sterile cartridge. Each patient gets a new cartridge that should be sterile and won't be used again on them or on anybody else. And again, those needles are so small that it's really just micro injuries that tell the skin to bring healing, but those injuries themselves are very, very small. You can't see, they're microscopic. And so the only risk with microneedling is either if a provider does not use a new cartridge each time. Obviously, that should never happen, but that's why having providers, doctors that you really trust is very important. Make sure that you're going to a high quality medical spa or clinic. And the only other time you wouldn't want to microneedle is if you have an active infection or condition on your skin where microneedling would then spread it. So for example, if someone has active skin cancer, not a good time to do microneedling. If they have acne all over and you're going to be spreading bacteria, yeast, possibly virus around, you don't want to do that either. So those are the times that we would not do microneedling. Otherwise, it's very safe.
Okay, so we're running out of time already, but let's talk about what is the downtime? A lot of times when we have cosmetic procedures, everybody's like, oh, the downtime. You just mentioned the sun exposure. How long till you can bring yourself back out into the world after microneedling?
So downtime with microneedling, if you use exosomes with it, that downtime is reduced. Exosomes are naturally anti-inflammatory, whereas PRP is inflammatory. So right after a microneedling treatment with exosomes used topically, you're going to see that pinkness, that redness start to go away within minutes. And it may still be there a little bit that evening or the next morning, but it's going to get much better over the next couple of days. Whereas with PRP, it's going to be, for most people, bright red for at least 3 days, if not longer. But regardless of which you use topically, it's really important to be careful with the sun. That's hard for me. I love the sunshine. But big hats, clothes that go up to here, not just sunscreen, like really try to cover up for a few days because it kind of hurts to have the heat right on the skin. Otherwise, we just say don't wash your face that night. You want to keep all those wonderful growth factors and healing factors in the skin. Don't scrub them off. And the next day, use really clean skincare and get back to your regular routine. So there really is no downtime other than you're going to be pink for a few hours and maybe into the next day.
Well, doctor, let me just repeat that because as someone who is really active and doesn't like to sit around, did I hear you right? Did I hear you say that with exosomes in microneedling, you're going to be red for a couple hours, but if you do PRP, it could be up to 3 days?
Absolutely. That's one of the big differences. The other reasons I like
that's a wow.
I know. And the other reasons I like exosomes better than PRP, which I mentioned before, is you don't have to get your blood drawn. So it's easier on the patient. It takes less time. They're more consistent in the concentration. And you leave and you're already less red and the healing happens more quickly. That's the other point I wanted to mention, is that you'll notice in a couple of days that your skin looks brighter and more radiant, but about 6 weeks to 8 weeks is when you notice the most healing, scar reduction, the little lines off the lips and eyes are better. But get this, we continue to remodel our skin for up to a year. So I literally have patients call me a year later and say, why is my skin still getting better? And I'm like, because it's still healing. It's still utilizing all those wonderful growth factors we put in it. It's not done yet.
Well, no wonder you're so excited about it because, the vampire word does scare you a little bit. And so it has significantly more growth factors. It's less downtime. and there's less side effects of, I guess, preparing for it. Is that kind of the bottom line?
Yeah, absolutely. And, some people, if they have a lot of scarring or deeper fine lines, they may want to do 3 treatments over about 6 months. Other people, if they're doing it more preventatively, they can do 1. And literally, some of the results can last 6 to 8 months. Some of the results can last forever. If you have actinic keratosis or a scar and you do microneedling with exosomes, you may notice a difference after 1 treatment that literally remains healed forever. So that's part of why I get so excited, is I love hearing back from patients when they've had 1 treatment, they've had 3 treatments, a year later, they're going, why does my skin look even better? And I'm like, I told you, there's a reason I do this all the time.
That is so exciting. I know we're out of time, but I mean, you talked a little bit about how long they last and how often you need to do it. I mean, it sounds like it's safe. Everyone does it as long as you do it with a trained medical professional, correct?
Yeah.
And that's good. And that exosomes, a relatively new player to the field, but they sound like they really can provide doctors with another tool that they never had before. Is that basically it?
Absolutely. Exosomes are an incredible tool. So what's really important is having a company that you trust and knowing how they're harnessed and feeling good about the decision you make on which exosomes you're using. And other than that, using them is easier than working with PRP. So for me, it's a no-brainer. My patients are happy. Their skin is getting better more quickly. And, when we feel confident and radiant, every area of our life gets better. Our entire health gets better. So the skin is just a window to your entire health and life.
Hey, so you did mention something that I think before we end, it's important, is there are different types of exosomes. And I'm not obviously clinical, as you know, but I understand that the company that you use, it's called Exocell Bio, or the product is Exovax. And the reason that you chose it is because there's actually the manufacturing process that they go through, that there's actually more real exosomes, and their morphology, is that the word, means that they actually maintain their shape. Why did you pick Exovax, I guess, is before we end?
I chose Exovax because I could more easily find with their company all of their testing measures, and also how they choose where the exosomes come from, how they're tested, how they ensure the concentration. And I felt that I could trust this company over the others that I saw in the field.
That's good, because obviously, I think, when because of COVID and the word RNA, and kind of people's opinions about, are we putting things in our bloodstream that have chips in them and other people's DNA and all that kind of stuff. But what the exosomes don't have any DNA in them, and so it's a very safe. And I guess exosomes are kind of like the little communicators between the cells, and so when you feed them with growth factors, then they're taking those growth factors to the various cells. That's my visual I have of it. Is that a good one?
That's exactly it. And that's why I mentioned, at the beginning, that they're extracellular, but they communicate with the cell and they get the wonderful cytokines and growth factors for healing, but they don't get the things that we do not want, right? So we don't want DNA. We want healing factors. We want our skin to glow and be radiant like when we were little, but we don't want what else comes with that. So that's why the testing process is so incredibly important. And that's why I trust Exocell Bio.
Well, Doc, we've gone over a little bit, but it was so fascinating to learn about exosomes and, of course, microneedling. You hear the term PRP all the time, so thanks for explaining the difference between PRP and microneedling and exosomes. I think that was important. And if you want to hear this again, next week we'll have it up on epigeneticsrx.com's YouTube channel, and so we're happy to pass it around to everybody in our group too. So, Doctor, thank you. It's
Thank
been
you, Deb.
wonderful
Thank
seeing
you,
you
everyone.
again.
Reach out with questions. Have a wonderful day.
Take care.